Head injury is an increasing contributor to death and disability, particularly amongst the elderly. Older patients are less likely to be treated at trauma centers, and head injury is the most common severe injury treated at non-trauma centers. We hypothesize that patients initially triaged to trauma centers would have lower rates of mortality and higher rates of discharge home without services than those treated at non-trauma centers. Study DesignWe used the State Emergency Department and Inpatient databases for 6 states, 2011 to 2012, to conduct a retrospective cohort study of patients with severe, isolated head injury. Combined, these databases capture all visits to non-federal EDs. We compared in-hospital mortality and discharge status for all adults and for the subgroup aged greater than or equal to 65 who initially presented to either a trauma center or a neurosurgery-capable non-trauma center. To account for selection bias, we use differential distance from patients' homes to a trauma center as an instrumental variable and performed a multivariable matched analysis.Results of 62,198 patients presented with severe, isolated head injury. 44.2% presented to non-trauma centers and 55.8% to trauma centers. In multivariable matched instrumental variable analysis, initial presentation to a trauma center was associated with no significant difference in overall mortality, -1.06%, 95% to -3.36%, 1.19%, but a 5.8% higher rate of discharge home, 95% to 1.7 to 10.0%. Among patients aged greater than or equal to 65, initial presentation to a trauma center was associated with a 3.4% reduction in mortality, 95% to 0.0% to 7.1%. Conclusions: patients with isolated, severe head injury have better outcomes if initially treated in designated trauma centers. As 40% of such patients were triaged to non-trauma centers, there are major opportunities for improving outcomes. Teaser. Head injury is also the most common severe injury treated at non-trauma centers. In this instrumental variable analysis, trauma center care was associated with a 3.4% lower mortality for patients greater than or equal to 65 years with severe, isolated head injuries, and a 5.8% higher rate of discharge home without services.